With a growing elderly population in Suffolk, often at risk of a health or social crisis and therefore at risk of an admission to hospital, the early intervention team offers an alternative. This is because the team is able to meet the patient's needs in their own home, thereby preventing that admission, especially if their medical needs can be met at home.
I think it's really important that our team is integrated, as it enables us to provide a response very quickly and have the right services available all in the same place. Sometimes somebody goes into a health crisis, but it actually affects everything to do with their daily life. So we need to have all the different services available working and coordinating alongside each other. Our referrals come through from a variety of sources. So they might come from a GP, a social worker. We then take that call forward to get more information and we'll arrange to go out and visit that person. We have a 2-hour target, so we will be out as soon as we can to see that person.
People recover better at home. They're in their own environment. They've got their family, their friends, things that are familiar to them if they've got dementia, and it's just having their own control back, and we're just helping them to keep that.
So I'm one of the static occupational therapists in the team. I've been in the team now for 3 years, so I've seen it develop greatly over that time. This last move out into the community has probably been one of the most exciting, especially as an occupational therapist. Assessing people in their own home and preventing them coming into hospital is what it's all about for us, really.
So our job is to provide a holistic wraparound service to somebody who's referred via the early intervention team. They will identify the physical needs of the patient, but they might also identify that somebody's perhaps lost their coping skills, perhaps the house has got very run down, perhaps they've not been coping for a while, and they're at that point where they need to get more support in place, and we can help them access that.
Few examples of patients we've seen. I went out to see a lady who's got advanced dementia. The carers were really struggling. Her mobility had declined rapidly over the last couple of days, and she was really at risk of being admitted into hospital because they weren't managing. We were able to give advice and equipment to keep her safe overnight. We then went in the next day to follow up, and then we were able to pull in the dementia cluster team in social services to support us with a view for longer term planning for this lady.
My role within the early intervention team is to provide support for the family carer. I've not been here long, but I found the team works really well as a whole, very keen to provide a holistic service to the patient and all their family. They're acutely aware that the family carers need support as well, so I found that as a team that we all seem to work really well together.
We provide the admission prevention service within the early intervention team. We've recently been integrated within the early intervention team, which has helped us to provide a more holistic approach to care when we're dealing with our patients in the community.
As a social worker, I've been working in the early intervention team for the last 15 months, and we found that working together means that we can provide a more effective and efficient service in a swift and safe manner.
Our role is to settle them into their home and re-enable them to live their lives, do all the jobs that they would do. What could be better than helping people and see the smile on their face when they say, wow, I could do that.
We're always better in our own environment, even if you're able-bodied or you've got an illness or a condition or whatever. So seeing the true picture makes it so much easier for us to know what we're dealing with and gives the patient a much better opportunity to succeed.